Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. On Sunday, the number of patients in South Korea critically ill with COVID-19 was over 1,000 for the second day in a row. The new daily infections also remain stubbornly in the several thousand range, despite the country's very high vaccination rate. The South Korean government has also reimposed restrictions to try and contain the surge, but these measures staying in place until early January, but very likely to be extended, of course, and perhaps even toughened if the situation worsens, like many experts predict might actually happen. Also, as we just heard from our Kim Yeon-sung, the number of COVID-19 deaths per day is also rising rapidly.
Right, and before, South Korea might see daily deaths in the single or low double digits. Now, we are seeing numbers in the high 70s to 80s each day. However, despite its rampant spread in other parts of the world, especially in Europe, South Korea hasn't yet reached a cumulative 200 cases of the Omicron variant, despite confirming its first case a few weeks ago. For more, we connect to Dr. Alice Tan, internist at Ms. Mary Women's Hospital in Seoul. Good morning, Dr. Tan.
Good morning.
Now, doctor, given how quickly it's spreading globally, Omicron appears much more transmissible than previous strains. For example, the UK is now seeing, 10,000 new Omicron cases a day, and population-wise, there isn't a huge difference between the two countries. So why is Omicron barely spreading here in South Korea?
Well, I think in terms of the two countries, if we compare the UK with South Korea, first of all, there is a huge difference in the level of transmission of COVID in general in the two populations. On December 18th, according to Our World in Data, the number of average daily new cases in South Korea per million population was 133, whereas in the UK, it was 8 times higher. So their number of daily new cases on average per million population was 1,067. So the amount of COVID transmission going on in general is much different in the two countries. Secondly, the level of restrictions was much looser in the UK. They only tightened restrictions very recently. And I think that contributed also to the spread of COVID in general, but also Omicron. Also, the volume of travel between South Africa and the UK is very different from the volume of travel between South Africa and South Korea. The UK is the #1 country that has tourists going into South Africa in the world. So I think they're just the number of imported cases, the volume was much different. And then lastly, I think that there is a difference in reporting of Omicron cases. In the UK, they are reporting all PCR cases with what is called a S gene target failure as a probable Omicron case, whereas in Korea, we are reporting only genetically confirmed cases and epidemiologically probable cases in our tallies of Omicron cases. So I think in South Korea, there is just less reporting of cases. However, there are probably many more cases that are not diagnosed, that are not being reported in South Korea.
Yeah, that seems to be the case with the Omicron variant. Some people reporting absolutely no symptoms at all. They could be walking around spreading it for all we know here in South Korea. And Boris Johnson having a torrid time in the UK due to his government's response to COVID as well, whereas South Korea has done a reasonably good job thus far. But critically ill people, top 1,000 yet again on Sunday. Could you describe the kind of strain this is putting on the healthcare system here? And is it lopsided? And by that, I mean the most severe cases, I assume, are all sent to the country's biggest hospitals.
Yes, I would agree with that second statement. And that's only because the tertiary care university hospitals have the largest ICUs and the best ICUs in terms of staff and experience and equipment. And so there is a preponderance of cases being sent to the largest hospitals in Korea for their critical care. In terms of the impact, I think we are seeing the impact of COVID-19 on the medical system, and it's starting to spill over into other conditions as well. Of course, when you have ICUs so full of COVID patients, patients with other medical conditions who need critical care will not be able to access hospitals in a timely manner, and that will negatively impact medical outcomes. We're also seeing shortages, not just of bed space, but of equipment, personnel, blood supplies, and so some medical personnel have described this as a warlike situation. And I can't imagine of any other situation other than the pandemic or a war where we see 500, 600, 800, 900 new admissions daily. And this has been going on, for weeks now. And so this is certainly a very concerning situation, not to mention the burnout that it's causing among medical staff. I mean, this is going to take a toll.
Yes, it is indeed very concerning. Now, going back to the Omicron variant, now, Dr. Tan, how do the symptoms vary from the Delta variant? And for people who have had their booster shots, how does that affect their immunity against Omicron?
Well, the good news about booster shots is that they do seem to offer a very high degree of protection against the Omicron variant, not so much in terms of infection, but we presume that it will protect against hospitalization and deaths due to the Omicron variant. In terms of symptoms, so far in Korea, the most common symptoms have been headache, chills, fever, sore throat, and cough. There seems to be less loss of taste and smell with the Omicron variant compared to the Delta variant. But, I would like to stress that some people at the beginning, they said, oh, Omicron is going to be just like a cold. Nobody dies of a cold. And yet there have been at least 7 fatalities due to the Omicron variant reported out of the UK. And so we do need to stay vigilant, and we need to remember that severe cases and fatal cases can result from the Omicron variant as well. This is not a simply benign condition like a cold. We need to stay careful.
Right, and just finally, something been speaking to people around Korea, and they're saying, oh, we're going to have to get this booster shot again, and maybe in 6 months' time we're going to have to get another booster shot, and people are wondering how much longer this is all going to go on for. Personally, how long do you think that people are going to have to keep taking these booster shots every 6 months or so? Is it going to be something that's going to last years and years? And also, if someone decides, look, for whatever reason, maybe they had a bit of a nasty side effect to one of the vaccines and say, I don't want to do this anymore, then what's going to happen to them?
Right. So the prediction is that in terms of vaccine supply and vaccinating the entire world against COVID-19, that's not going to happen until 2023 or maybe 2024. So it does look highly likely that most people will require a 4th dose booster against COVID-19. COVID-19 is now an endemic disease. It is not going away. The good news, though, is that we can look forward to oral antiviral medications specifically directed to COVID-19. And one of those medications, molnupiravir, has been shown to dramatically decrease transmission of COVID-19. In other words, decrease viral load, making people much less infectious after just a few days of taking the medication. So I think once we have larger supplies of antiviral viral oral medications against COVID-19, the dynamic and the impact of this disease on the world will change significantly. In terms of how much longer we need to do, booster shots, there has been a call to develop what's called a universal coronavirus vaccine that is durable in nature. And so hopefully, once something like this is developed, we will not need every 6-month boosters. But it may be a situation similar to influenza where we have high-risk groups who need to get a yearly influenza shot. And so that might be the situation going forward, that vulnerable groups may need to boost their protection against COVID-19 for many years coming forward. This is something that I think people need to mentally prepare for.
All right, Dr. Tan, as always, we're grateful for your insights and thank you so much for joining us.
Thank you.